Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College. Today we're going to learn about home health care, something we may all have considered as we age. My guests today are Jamie Matamoros and Anglie Ramessar, who are both home care case coordinators for Direct Personal Care, a New York State certified health care agency. Jamie and Anglie, welcome to Your Family's Health on the Voice of Nassau Community College, 90.3 WHPC. Welcome.
Thank you. Thank you for having us.
Thank you so much.
This is such an interesting topic. So tell me a little bit more about you both and what made you want to focus your career in home health care.
Alrighty. So I'm actually a student here at NCC.
Oh,
so yeah, I saw you guys have this podcast,
Right.
beautiful, so I was like, why not, get direct personal care on the podcast, and then expand our business and also, inform you guys about the home care health industry.
Mm-hmm.
So yeah, that's a little bit about me. I'm a student here.
Okay. How long have you been working in this capacity?
I've been here for almost a year already.
Okay.
Working at Direct Personal Care located in Mineola. Mm-hmm.
Anglie?
Yes, I would like to say thank you so much for having us here today. It's been an honor. And my name is Anglie Ramessar, and I'm working for Direct Personal Care.
How long?
It's been more than 3 years.
Nice. Okay.
Yes.
And have you found it enriching and enlightening in some way?
It's very interested.
Mm-hmm.
Working in the healthcare field, it's very interested.
So this is a question for both of you. For those that don't know about it, what does home health care entail and who qualifies for this kind of care?
So the people who qualify are those who are 60 older and who are disabled or have trouble, doing daily activities, has, just brushing their teeth or even walking, So those are the ones who qualify. Mm-hmm.
Is it a certain socioeconomic group that qualify, or can anyone?
So patients that are qualified,
Mm-hmm.
these patients have to be chronically ill, disabled. They're the one who's qualified for the program.
So is this program something that's referred by a physician or a primary care provider, or can someone just walk in the door and give their criteria and be eligible for this kind of service?
It could be both ways.
Mm-hmm.
A physician could recommend the patient. As the physician assess the patient, they could recommend the patient. Also, patient could walk in or they could call us, let us know, okay, I'm interested in applying for the home care service.
Mm-hmm.
Then we'll walk them through with the steps.
So what does this look like in terms of paying for this kind of service? Is this something that maybe Medicaid, Medicare will take care of, or is this out of pocket?
It's a Medicaid funding program.
Okay.
Which patient who's chronically ill, they could qualify for it. So as long the patient have Medicaid and Medicare, they're qualified for
They're
it.
qualified.
Yeah, it's called the City PAP program. Mm-hmm. Consumer Directed Program.
So tell us what Direct Personal Care, what do they specifically provide? I know you talked about possibly getting out of bed, eating, those kinds of basic things for activities of daily living. Is there anything else that's provided, or give me more that the Direct Personal Care provides?
We provide very qualified home health aides, as well with the City PAP program. It's all consumer directed. So if the older person, who wants to receive care, they can choose who they would want them to do care for them. It could be a family member, a grandchild, any family member, they can choose who takes care of them, who they feel most comfortable with.
Oh, that's great.
Yeah, so they don't have to feel like, for example, a random person coming into your house or anything, they receive the care, the provided care they need from the comfort of their own home.
So this personal care provider, are they compensated for their work? Even though they may be a family member, maybe it's a grandmother, and they come in, it's a child that comes in to take. Are they compensated for this monetarily?
They are compensated. Yes, that's a good thing.
Oh, that's a great thing.
Yep, they're compensated for their work. Like they can work 8 hours, 4 hours, depending on how much care the patient needs. And yes.
So is this hourly basis that the coordinator would be compensated for the care of their loved one? Is this hourly or is this just a stipend?
It is all depends how many hours the patient is qualified. It's approved from the state for.
So what does the family member need to submit? Is that family member have to have a history in health care in order to provide care for their loved one?
No.
Okay.
As long he or she is over 18 years and above and legally could work in the country, authorized to work in the country, they could do it.
Yeah, that's great. Is there orientation process for the family member who may say, I really don't have the tools to take care of grandma or grandpa?
Yes,
of course.
Yes.
Yeah. Our direct personal care, we inform our, they don't have much experience. We inform them as an orientation, what to do. For example, if a patient falls down the stairs, immediately they need to call 911. Stuff like that, we train them, we give them an introduction of how the care would be, and any problems, they can always give us a call, direct personal care.
That's wonderful. And then you also give them probably resources to contact, like you said, 911, maybe if they need help with their medication or, you have a question with the pills that they're going to take. All of those resources are provided for.
Yes.
That's great. So the loved one can actually be at home and cared for by the people they know.
Yes.
All right. That's good to know. So what do you do in your roles as home care case coordinators? What do you specifically do? What is your role?
We monitor the aid and the patient as well as Medicaid. We assist Medicaid.
Like, for example, we make sure the caregiver, that the patient is receiving the care they need from Medicare. As we're helping, we're assisting Medicaid. We are FI. We just monitor, that the patient is receiving the care they need from the loved one, the caregiver.
So what you do is probably go into the homes and go to their places to kind of do checks every now and then.
Yes, at times.
Okay, to make sure that things and the care is given at a certain level and that person or that patient is safe.
Yeah.
We coordinate over the phone
Okay.
as well. And sometimes we usually coordinate with, like, let's say, for example, the aid need assist at home. We do that also.
Oh, okay. So I understand you work alongside Consumer-Directed Personal Assistance Program. Tell me what that's all about.
All right. So I did, as I said, the Consumer-Directed Program is all about the consumer, the patient, who they want them to receive the care for.
Okay.
Yes. So it's a New York State assisted,
So this is by the state. This is a state-run program.
Yeah. Yep. Correct.
Okay.
Yes, I can also give you like a little overview what is CDPAP program.
Okay.
So CDPAP program officially take place since April 1995. When it was authorized by the New York State Department of Health, CDPAP program is a consumer direct assistance service, which allows Medicaid participants to pick a family member or close friend to take care of them. And that person will basically get paid. In that, we don't need any special certification or license required.
Okay.
It's approved service to chronically ill patient or disability patient.
Who is not eligible? Is there anybody that's not eligible?
Those who, for example, it's Medicaid. It's all
Right.
funded by Medicaid. So if you don't have
So
Medicaid,
if you don't have that,
yeah, then it would be harder to assist you, or perhaps the HMO can
As long the patient have Medicaid, we're accepting Medicaid and Medicare.
as long as they have those,
yes,
those are the
one-
individuals.
Yes.
And
If,
over the age of 60.
let's say some of the patients don't have Medicaid. If they don't have Medicaid, they could get qualified under their HMO.
Oh, that's good to know. You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning about home health care with my guests today, Jamie Matamoros and Anglie Ramessar, who are both home care case coordinators for Direct Personal Care, a New York State certified healthcare agency. So this is a very interesting healthcare model. Are we seeing more and more of a need for this kind of healthcare model? Do you think people really want to stay living in their home and not going into a particular facility? Living at home is very important for most people.
Yes, they're more comfortable with their own loving one to take care of them. They feel more secure and they have more trust.
Yes, they do.
No.
Yes.
It all depends on the person, how they want to be taken care of. Sometimes there could be overcrowdedness in the assisted living. We have to resort. That's why the state, New York State, invented, consumer directed personal care, the CityPAP program, because of that.
Have you ever ran into any situation where a family member had to be dismissed because they were not meeting the patient's or the loved one's needs? Have you ever experienced that?
No, for me, no.
No, not we know.
Oh, that's great.
Yeah.
So for the most part, what you're finding is positive outcomes.
Yes, for sure.
We do.
Positive outcomes. So how many people have you serviced? Is this primarily you see people in the Nassau Suffolk area,
Yes.
or is it the full metropolitan area?
No. We serve within the 62 counties.
Okay.
Yes.
And so do you find that there's more of a need in one county over another, or it is just disseminated throughout the area?
Yeah. I
The
feel like
need.
Throughout the area.
yeah, throughout the area.
So how is Medicaid monitoring the program?
One of the ways Medicaid monitors, of course, we have reassessments every year. The nurses come into the patient's home and they see how they're feeling, and then that's how they get reassessed every year. As well, how we have we use a CARET app, a clock in and clock out app at the company, right?
We're doing EVV,
What is that?
electronic verification.
Okay.
Yes.
And that electronic verification verifies what exactly?
Where the patient is, receiving the care, if the caregiver is at the, where they're supposed to be working.
Okay.
Yeah, as well as the amount of hours they do. And, we see the location, the amount of hours, we see everything there. And yeah, we also work with timesheets as well, where the caregiver also provides, hours, where, like it's little time logs,
Okay.
timesheets. And we also, of course, we make the weekly phone calls, make sure they send their timesheets on the coordinated times.
So do you have a standalone established place where the caregivers go to give their time slips in? How does that work?
They email it. We have email address.
Okay.
Sometimes some of them would send it as a text message.
Yes.
Okay.
Yes.
So where does the orientation happen? Does this happen in-house, or do you go to the site to do an orientation with the caregivers who want to give care to their loved ones? How do you do the orientation?
It's a mix of both. We usually, the most faster, way, and we go through a very in-depth orientation through the phone. We, any question the caregiver has, we answer them, and they know that anytime if any situation happens, they can give us a call at our number. And of course, and we also do insight visits as well. We let them know like how to this and that, third. Yep.
Have you ever seen, and I am a nursing professor, as you
Yes.
know. And I'm wondering, this really would probably spark a young person to want to get into the field of nursing or healthcare, because what they're doing basically is an act of love, would you say?
Of course.
Right.
Because how can you compensate for giving care to a loved one? And this is something that really starts the ball rolling, right?
Yeah.
With providing that kind of care. Can you provide any kind of stories that you've heard from people who have given care to their loved ones and really had some positive stories that you can share with us?
I don't have the top of my head right now, but I'm pretty sure that everyone loves their they're taking, for example, we have people who takes care of the grandparents, and another reason why I wanted to come here on NCC was because I know college students were very busy,
Right.
and they probably take care of the grandparents, aunts, uncles,
Yes.
and they can also as well as managing college is very hard. As a student here, I know how it is.
Yes.
They can also make wage and also do at the love from the bottom of the heart, taking care of their loved ones.
Yes. Yes. And what a good way to remember your loved one.
Yes.
When you really are doing the hands-on, making the coffee in the morning, giving the meds and, giving that kind of personal care. That's really something that you really don't forget. So I understand you also work with something called Durable Medical Equipment, DME.
Yes.
Can you tell us what that is and what does that mean?
Yes, so we have another company which is Rihanna DME, which is Durable Medical Equipment. And that is basically like whoever is same with we're doing with Medicaid, Medicare, also dealing with other HMO as well. The medical equipment. Let's say, for example, a patient get discharged from the hospital, may need a hospital bed, walker, cane. So that person will have the prescription. They will send it to us. Sometimes we receive called. Also, we process it with the insurance, and we are also do delivery for it.
Oh, that's great.
Yeah.
So if you need a Hoyer lift, something that helps the patient out of the bed, or a walker, or a cane, or a bed, so much equipment is needed.
Diabetic shoe, orthopedic shoe.
Yes.
Diabetic supplies.
All of that comes through this DME.
Yes.
Oh, okay. And with no charge.
No charge.
That's wonderful. Yep. And so when it comes down to, okay, I'm finished with the equipment, does the company come and get the equipment back, or is the patient's family responsible for getting rid of it?
Hospital bed, insurance don't cover it. It's a rental.
Oh, it's a rental.
Yes.
So we are renting it, and Medicaid, Medicare is paying.
Yes, it's a 12-month rental, and insurance pay for it.
Oh, that's good. All right. And now, how does it work with? Do you do also hospice care with this kind of model, where end of life, when patients who may be dying would qualify also for this kind of care for their family members, or it's anyone with a chronic illness?
Anyone with a chronic illness.
Anyone with a chronic illness. So tell me, has anyone or any family member have come back or report back to you and said, well, my loved one has been in a long-term care facility and now they're being taken care of at home. I love this better. Anybody has said that to you, reported that to you, that they like the model because they're in the house or they're in the home setting as a coordinator? Have you heard that?
No, we haven't. But we just assume they love the care. It's way more easier. Than what the care the patient is receiving.
Right.
They're not being abused somewhere else. Or being mishandled in like an assisted living where it's a stranger taking care of them. And here, with the City PAP program, it's the loved one taking care of the patient, and the consumer, of course, has full control of who takes care of them.
You're listening to Your Family's Health on the voice of Nassau Community College 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning a lot about home health care with my guests today, Jamie Matamoros and Anglie Ramessar, who are both home health care case coordinators for direct personal care a New York State certified healthcare agency. So my question to you is, okay, the patient is in the home with their family member and they need to call the doctor. Okay, they need to call the doctor. Maybe mom or dad or grandma is having a health problem.
Mm-hmm.
Do you coordinate when they go to the hospital? Or if they need to go to the hospital, who makes that call and judgment?
If the patient got admit, if they're getting service already,
Right.
and if they're admit, they fell sick and they admit in the hospital, yes, the patient or sometimes the family member or the aide will give us a call. They will inform us. Then we usually notify the insurance as well. We have to notify the insurance.
Okay. So I know you employ only home health aides, right? Not certified personal care assistants. Is there a difference, or you just only hire HHAs and family members?
We are doing CDPAP program
Right.
as well, HHA.
Okay, HHA.
Yes.
And what is HHA? They are what? If for the listeners who don't know what HHA stands for and what their role is exactly.
HHA is when when the patient is chronically ill and they don't have any family member to take care of them, then they will need a certified aide.
So it's called HHA is home health aid. Okay. They are really trained
Yes.
to make meals.
Yes.
And what else are they trained to do?
Make meals.
Do they clean the area?
Yes. Also the cleaning
Okay.
and bath
Okay.
as well. What else?
Turning the patient, getting the patient up, maybe.
Yes. Assist with the medication.
Okay.
Also
Feeding them?
take patient to doctor's appointment.
Oh, that's great.
Then another thing is some of the patient, they need companion.
Mm-hmm.
So there is where the aid,
Communication.
with companion for them.
Yeah, communication is so important
It
with the
is,
home health
yes.
aid as well. Yes.
Yes.
Yes. So how can someone find out more information about this service that you are providing and that you are a part of?
We have a website. We have in there, you can find out all information about CDPAP program, the services we offer.
Sometime we usually go out there also, visit doctor office. We go to hospital and stuff like that.
So you would, if someone's in the hospital, we can actually go to the nurses station and ask, someone can go and say, I need help in my home, and they will give a referral to you.
Exactly. We receive a lot of call also over the phone. Sometime our own aide would recommend people out there for us as well.
So your website is Direct Personal Cares with an S.
Yes, cares.
.com.
Correct.
Is there a phone number
Yes.
connected to this? May you share that? Or do you have it? Or just go to the website?
The telephone number is 929-424-1405.
Okay, that's good to know. So if you can give us a story or can give us why we need to really think about this kind of model right now in our community as it is, why would you say that this is something worthwhile? What is your thought?
Well, lately, we have been seeing there's been a lot of abuse in assisted living. It's a very sad thing because, the older people are the most sensitive people. They are the most vulnerable people. And of course, has been a younger person. I'm not saying everyone, but, some people take advantage of that.
Yeah.
And they, you would never know,
Right.
And, the poor older person who's vulnerable to that, they're high risk, And with the CDPAP program, I admire how, the consumer is at full control,
Yeah.
They can say, okay, I want for example, my granddaughter to take care of me. I want my nephew to take care of me.
Yeah.
It's not like just put on you. If you just take the assisted living, you don't know what happened. God knows what can happen to them there, you know?
Yeah.
Yeah.
They're a very vulnerable
Yes.
segment of our population, and they are a growing
Yes.
segment of the population, would you say? And I'm noticing, as you are, ladies who are in this field, that because they are a growing segment of the population, we want our older adults to stay in the home as long as they can.
And to be happy.
To be happy and to feel like they really are getting a quality life, especially the end of their years where they are really with loved ones, the people that really love them. So now, when you talk about loved ones, if I have like a family of 10 or 20, can all my loved ones chip in and help out grandma? Can we all sign up for this program? You know, bring the 5, 6, as long as they're over 18, right? Can they all chip in with this kind of care?
Yes, we do. Like, I have a patient who is getting like four family members taking care of one patient.
Right.
Yes. They usually like split the hours.
And that's good because then you don't have an overtaxing of one family member. You can share in the love. You can share in the care. Well, thank you so much for being here, Jamie Matamoros and Anglie Ramessar, who are both home care case coordinators for Direct Personal Care, a New York certified healthcare agency. We want to thank you for giving us this very important information, and we hope you continue to stay healthy, both of you, for doing and continue to do the great work that you're doing.
Thank you so much for having us.
For having us here.
And thanks for being here. This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.